Researchers in Calgary have laid the groundwork for developing new therapies for children with early brain injuries by using a robotic device to measure their proprioception, or position sense. Position sense is the unconscious perception of where the body is while in motion or at rest. For instance, closing your eyes and touching your nose requires position sense.
Our research program focuses on kids who've had strokes at birth, which to most people's surprise is quite a common occurrence. These are brain injuries close to the time of birth that result in a variety of disabilities, most often a physical disability. That's a type of cerebral palsy. These children usually have a physical disability on one side. Their arm is weak, so we've often in the past tried to just focus on making it stronger. But we've been learning, thanks to technology like this, that that's not all of the problem. And in fact, their brains also have trouble understanding where their arm is in space or where their hand is in space. And this is important for daily function because we could make a hand or an arm maybe a bit stronger, a bit faster, but if the young person if their brain doesn't know where the hand and arm is in space, they're not going to be able to use it very well. So this robot technology allows us to measure that very precisely about how their brain is processing sensory information, particularly position sense. And we think this is a very important element that in the past has been really understudied and neglected. And this tool will let us understand it better and give us some new ideas for rehabilitation therapy.
Max Challoner, a 12-year-old participant in the Calgary study, had a perinatal stroke that left him with mild physical impairments on his right side.
So this is the KINARM robot. So basically they slide me in there and they position my arms. So it'll move one of my arms and then I have to match it. So it maps out. So then they can see it on the screen and then how I move.
So what's great about our KINARM robot is that it can objectively measure if somebody knows where their arm is in space, or what we call position sense, and then we have many tasks to look at different aspects of movement, and these are things that some clinical measures that we have right now cannot do. So our research has shown that children who have had a perinatal stroke, they have impairments in knowing where their body is in space and different aspects of movement, such as movement time or how fast they're moving. And once we've been able to describe those differences, we might be able to use the KINARM robot in the future to target and personalize rehabilitation. So Max, on the right, you see a white dot. Can you put the index finger on the right underneath that dot and say okay when you're there?
Okay. Okay.
Perfect. So now we'll do the same on the left.
Okay.
I think it's great now that we know that Max's proprioception is within a normal range, and I think if we can be part of this research program that's going to help families, then I think that's really great.
This has been a large study now, over 50 children who have the strokes that I mentioned and have cerebral palsy. And we've had the very generous volunteering of lots of healthy kids, more than double that number of healthy children who've been able to come in and do the same testing, and that way we can compare the normal developing brain to the injured brain. Gives us a lot more information. So well over 100 children and their families have participated. We like people to understand about how important early injury is in the brain in children. Strokes are just one example. There are thousands of kids here in Calgary who have cerebral palsy of different types, and research like this is trying to understand it better so that we can develop new treatments. I think that's what this is all about.